read is on the next page. And all of that is antibiotics. So here's the page you should be on. Mastectomy, Mammogram, right? Post-mastectomy. I want you to write at the bottom, mammogram. I just want you to kind of have a little holy hook up. This whole page is for breast cancer. Okay, so we're going to put a lot of stuff. Now, I don't know if you've been paying attention, and you can probably, you know what I want you to do before we start our breast cancer real quick? Turn to the first page again and write this for me. The number one cancer in America that kills you is what? Lung. Very good. Lung cancer is the number one killer cancer. But number one cancer that is also very common, but it just doesn't kill you as fast as that one does, is skin. So skin cancer and lung cancer are the number one cancers in America. If they ask you which is the deadliest, make sure you say lung. Okay? Because you don't really see skin cancer talked about because we're focusing on the deadly ones, okay? So if I usually ask this question, I'm going to ask you about the deadly ones. And so you got to say lung. If I continue along that same line and ask you what else is deadly, but I say for the female, it's the breast. If I ask you what's deadly for the male, it's the prostate. If I don't differentiate male and female, and I just say what's the next deadliest cancer, you better say colon. So I put them all on the board up there with numbers by it. So if I don't differentiate sex or gender, lung is first, colon second. However, if I throw what's the worst for the woman, then you've got to put breast. If I say what's the worst for the guy, you do a little prostate. Okay. Now the one that nobody ever figures out, they're very shocked to know, is bladder. Okay, so bladder is the next worst one. Okay. All right, now go back to the breast disease. Now, of course, there's a screening. It's called a mammogram, ain't that right? So the mammogram or squishogram, we start that at age 40, and we do this every year or two. Smushogram, which is a mammogram, right? Every year or two. No powder, perfume, Bath and Body Works, soap, nothing in the breast area, right? No powders, no perfume. Soap is okay to wash your ass. I mean, don't really twist to wash yourself up. Don't come in here stinking. So, but no deodorant, no lotions, no Bath and Body Works, no creams, no powders. Because it looks just like cancer when you come in here and talk about you here for your mammogram. All of that looks exactly like cancer. I've seen it. Okay, so no deodorant, no powders, no perfumes, no lotions, no creams, no oils, nothing. So far so good? Okay, no jewelry. I have a hard time taking my cross and crown off. I had to do it today for the mic or something earlier. But I have a hard time with that. So sometimes they're so funny, they're going to break the rule. Okay, turn it to the back, we won't say nothing. I'm like, no, I'm going to take it off, I'm a good nurse. And they laugh. So you just want no jewelry because it's in the way. Okay? Remember, it is radiation. It is radiation. Therefore, who can't have a screening mammogram? Pregnant lady, right? They can have a diagnostic one, and sometimes we have to do it and put a lead apron on and everything. But your test is going to be all about the screening mammogram. Can nobody pregnant have no screening mammogram? As we're screening you for anything pregnant, come on now. Okay, so no screening mammogram. Patients need to not get this test right before their period or it's going to hurt. So they should be doing it after their menstrual cycle, right? 7 to 14 days or 21 days before, after. So 7 to 21 days after, not right before. Ovulation is a fine time to get it done. Right after your period is the best time to get it done. Do not get it before your period. It will hurt. That's why you see some women say, "What's no big deal?" Then other ones say, "That shit hurt." For real, they're not getting it where they should. Okay. All right, so that's cool. Now, if the mammogram is abnormal, then you're going to need additional testing and maybe a biopsy. Additional testing and maybe a biopsy. So you already know that. Okay, moving on. Risk factors: age, genetics, dense breasts. You busty lusty all up in here. You probably won't see a cancer early on. It may be hard to decipher you have any cancer at all. Busty lusty. So you got dense breast. If they were down in your kneecaps, it would be easier to figure out. Because we can see straight through those saggy veins. The nulla para. Nulla para means what? They've never had a baby. Notice I did not say they never been pregnant. I said they did not have a baby. That's the difference. They never had a baby. So since they never had a baby, they have never gone through breaks from estrogen. Their entire life they've had estrogen and no breaks from it. Okay. History of infertility. Alcohol. A big one is obesity for a risk factor. History of positive breast cancer in the other breast makes you at risk for breast cancer in the other one. So history of breast cancer. And then estrogen. History of breast cancer, estrogen, obesity, infertility, alcohol, nulla gravida, dense breast, genetics, and age. Genetics is first-degree relative, mom, sister, daughter.
Was fibrocystic breast make you at risk?
No. Fibrocystic breast is benign. Okay, so mother, sister, daughter, first-degree relative. 1 in 8 will have it. 1 in 8 will get breast cancer. So you know the whole thing with self-breast exams are like, oh, you don't have to do those anymore. Actually, most doctors, including myself, especially after that lady told me she found her own lump in the mammogram was normal, most doctors know enough to know not to tell nobody don't do the damn thing. What we say about self-breast exams is we say that we want you to be familiar with what your breast feels like so that you know when the hell it changed and there's a problem. I personally just keep on going with the self-breast exams every month. What the hell is the problem? What's the downside? Nothing to me. Okay, so self-breast exams are not necessarily mandated, but it is important for you to be familiar. It's called familiarity with your breast tissue, so you know if something different happened, right? Okay, so you get it. Now, this mastectomy lady, or no, signs and symptoms. I don't care where you write it, just put signs and symptoms. There's not a lot. Anywhere you want to, put signs and symptoms. Signs and symptoms of breast cancer. Unilateral breast complaint. Good enough for me. Unilateral breast complaint. I don't care what it is. Itching, redness, flaking, mass, discharge. Again, unilateral breast complaint. Itching, redness, flaking, discharge, mass, thickened. I don't care what it is. Good enough for me to work you all the way up. So unilateral breast complaint. Remember the axillary area. It can be right in here. This is called the tail of Spence. It can be in the axillary area. The tail of Spence. All up in here is the most common place for breast cancer. Tail of Spence. Okay? Tail of Spence. Very common area for breast cancer. There may be retracting of the skin or dimpling. Retracting of the skin or dimpling where it's pulling the skin. So if I have my patients do this, they put their hands on their waist, I tell them to bend at the waist only and look up. I can see the breast cancer. It will not allow the skin to hang. It'll be grabbing it. Because one thing I know, and I don't know all of them, because the little girl with the little sweet pea lump didn't seem that serious. Of course, she found it and we worked it up and it was cancer, but it wasn't that serious to me in terms of if I was talking to her about what I thought it was. I might have got that one wrong, but I never do that. But when I know it's cancer, I will do that. So I've had the patient come in, and when I touch it, I already know it's cancer, you know. And why do I know it? Well, make sure you write this. Irregular border, painless, fixed and immovable. That's when you're like, oh. So irregular border, fixed and immobile, like it's stuck. I can't wiggle it. Irregular border, fixed, and it won't move at all. It just doesn't budge. And I'm going like this, trying to wiggle, hoping I can wiggle. If I can wiggle, it's a cyst. Irregular border, fixed, mobile, immobile. I can't move it. That's a bad feeling. Now again, I'm never wrong on the ones that I think are cancer, but I can be very wrong on the ones I think are not. That's why you have to work it all the way up, and that's why I don't tell patients any of that. I tell them that before I touch them. I say, you're going for this, this, and this. And they go, okay. Because if you wait till you touch them, you scared the shit out of them. We don't like to do that. If I think it's cancer, you ain't finna leave nowhere. I'm finna get a doctor to come in, or we're finna have an appointment before you leave, and we're gonna have a long conversation about what's about to happen. Okay, so we're gonna do things real different. Okay, anyway, let's go. Now, elevated temp and immunosuppressed, we already know that's amped. That will kill you. You know, you get a patient bleeding precautions and neutropenia precautions. Let's do colon cancer, turn to occult blood. Oh, by the way, you have on here mastectomy. Everything on here is all you have to know. I ain't gonna add, it's so good. I love these notes, okay? Pay really close attention to the fact where it says abduction, external rotation. I love those notes on there. They're really, really good. So abduction and external rotation. And the only thing I would add to your list is no manicures and no gardening. You already know no IVs, no blood pressures, and no needle sticks. So add no manicures in that area, in that side, and no gardening. Just in case you get dumbness on steroids, because you will, you're going to get a nurse who's been there longer than you, and she's going to say something ignorant as hell, like, oh, she had a mastectomy 20 years ago, you can do blood pressures in her now. Like she suddenly fucking got lymph nodes. Where'd she grow her lymph nodes from? The garden that she should be in? So make sure you know they can absolutely, positively not have blood pressure cuffs, tourniquets, IVs, blood draws, and IM in that freaking arm.
What happens if the patient's got double mastectomy?
Legs look good to me. Now why? If I don't tell you why, you ain't gonna comply. So why? What does that mean when I just said all those things? What does a blood pressure cuff mean to that?
So you're causing a constriction, and you're causing distal edema down at the bottom of my hand.
Yeah, you done push all the water in my whole arm down here. And what was the lymph node supposed to do? It was supposed to move fluid and fight infection. You moved the fluid down here. I ain't got no more lymph nodes. You took them out, remember, they had cancer in them. And now I can't move that fluid that you just pushed all the way down there. What's it gonna do? Sit, pull, make a cellulitis, could lead to osteomyelitis, especially in a hospital with MRSA. That's how bad it can be, an amputation of the arm because you're stupid. Okay, so you know better. Okay, now let's do it again. Why don't you stick needles in it, people? Why are we not doing that over here? What was the lymph node's job?
Infection.
Filter the blood, filter infection out of the blood, right? That's what the lymph nodes was for. It was supposed to filter infection out of the blood. You done poke holes in me and invited all kind of germs in my arm. And I cannot fight any of them. So now I'm infected, cellulitis, osteomyelitis, irritation. It just is ugly.